My name is Charles Parasino, and I will be moderating tonight's telephone town hall with Congressman John Larson and special guest Dr. Jim Cardon, a cardiologist at Hartford Healthcare. Thank you for joining our interactive Access Live event. This evening, Representative John Larson will be taking your questions and discussing the ongoing government shutdown. As I mentioned before, this will be an interactive forum, and we would love to hear from you. We will be taking as many questions from participants as we possibly can tonight live on this event. If you have a question for the Congressman, you can press *3 on your phone keypad at any time, and you will be placed in line to speak. The next time you hear your name, you will be live on the call and be able to ask your question directly. If you are joining us online, you can submit your question in the form below the live stream video on your screen. Congressman Larson will do his best to answer as many questions as we possibly can this evening. If the Congressman is not able to address your question tonight, please call 860-278-8888 and leave a message along with your phone number or email address. Our staff will listen to your voicemail and get back to you with an answer to your question. Again, if you have any questions throughout the event, please press *3 on your keypad. And to sign up for Congressman Larson's newsletter to receive updates and information about future events like tonight's telephone town hall, press *6 on your keypad. Now I will turn it over to Congressman Larson.
Well, thank you very much, Charles. And again, I want to thank everyone for joining us. We continue to do these throughout the shutdown, as I think many of you are aware, because we've been discussing this repeatedly. Congress should be back in session and doing the work of the people. We continue to go to D.C. I just got back this evening. But unfortunately, our colleagues on the other side of the aisle still have chosen not to come down and come to bipartisan compromise and keep the government open and, as importantly, make sure that our citizens get the critical funding and the health care that they richly deserve and need. We are now in the 29th day of this government shutdown. And I wanted to make sure we have plenty of opportunities to come together as a community and hear from you directly. I thank you for the many notes and letters that we received. I want to assure you that they all matter. But most importantly, and during these times when people are concerned about the service they're receiving from the federal government, especially in the area of Medicare, Medicaid, and Social Security or veterans benefits, please reach out to our office at 860-278-8888. Tonight, I am particularly proud to be joined by Dr. Jim Cardon. Dr. Jim Cardon works over at Hartford Healthcare, and he heads up the division over there that's responsible for all the doctors and all the medical attention that Hartford Healthcare does such an incredible job at making available to not only the citizens of the 1st Congressional District, but all across the state. And I'm pleased that he's here tonight to talk from the perspective of a healthcare professional, not a politician or elected official, but what this shutdown means, and specifically what these cuts that the Republicans have proposed to benefits, taking 15 million people off of their health care and having health care costs rise dramatically, doubling in most instances for people. I would also this evening like to take time to mention, as many of you on the line are aware, that our hearts go out to everyone in Jamaica and across the Caribbean who have been impacted by Hurricane Melissa. My office is working with advocates from across the West Indian community here in Hartford, and we are open and available to assist anyone with a loved one impacted by this severe storm. We have prepared web pages with resources available to citizens in Jamaica, as well as a web page with answers to common questions about the government shutdown. You can find both of those resources at larson.house.gov, and you can always call our office at 860-278-8888. That's larson.house.gov or 860-278-8888. Even though government is shut down, I want everyone to know that Medicare, Social Security, and veterans benefits will continue. But staff at all of these agencies have been furloughed, reducing the number of staff available to meet requests. And alarmingly, congressional offices have been told that their inquiries will not be answered. That's wrong, and of course know that, and our office continues to send and communicate your inquiries on your behalf. And so please call upon us. We're here to assist you. Airports are operating as usual, but the stress that people are dealing with is starting to see delays across the country. TSA agents and air traffic controllers are working without pay. Please take these into consideration if you're planning to travel during this shutdown period. You also have heard a lot about SNAP benefits. SNAP benefits will continue until the end of the month, which, of course, as you know, is Friday. And Congress authorized contingency funds to keep food and assistance flowing during the shutdown, but President Trump has said he will not authorize them and instead let SNAP benefits lapse for 42 million Americans, including 360,000 Connecticut residents. I thank Attorney General William Tong for leading the way with attorney generals across the states and putting a lawsuit together. This is legislation that has already been authorized and signed into law, and the money is there and available. The law clearly states that benefits must continue, and we will hold him accountable to it, and I thank the Attorney General for his leadership. Last week, our own Representative Jahana Hayes and House Democrats demanded a commitment that they release these funds, and instead, they said they will pause benefits. What does that mean? That means 120,000 kids in Connecticut alone will not know where their next meal is coming from. Do you think Donald Trump has ever had to worry about where his next meal was coming from? Do you think he's ever worried or had to sit down across the kitchen table and wondering how you pay the rent or mortgage, or the heating or cooling bills, or how you put gas in your tank? I know you know the answer to that. The good news here, though, I have to say, is that the state of Connecticut is stepping up. But our state shouldn't pay the price for Trump's failure to govern. On Monday, Governor Lamont announced that he would be releasing $3 million in state funding to support organizations like Connecticut Food Share and local pantries supporting residents. And our Attorney General, as I've mentioned before, William Tong, is suing the President in court to make sure that he follows the law to keep SNAP benefits going through November. And you can rest assured the whole delegation will continue to fight for you to work to keep these important programs going. We are in a healthcare crisis, and don't take it from me. You know how they say that politics can sometimes make strange bedfellows? Well, I never would have thought that I would be as closely aligned or admire the stance taken by Representative Taylor Greene. And many of you have heard of Marjorie Taylor Greene, but what she had to say this week to Speaker Johnson was pretty remarkable. And he tried to gloss over it, and she said, and I quote, "You left out that I said I have no respect for the House not being in session, passing our bills, and the President's executive orders." and I demanded to know from Speaker Johnson what the Republican plan for health care is to build the off-ramp of Obamacare and the Affordable Care Act tax credits to make health insurance affordable for Americans. Bravo, Marjorie. Thank you for being one of the few Republicans to stand up and speak truth to power. And if she's not just speaking to Speaker Johnson here, because Speaker Johnson doesn't do anything without consulting with President Trump. He follows his orders to the T. Well, Representative Taylor Greene went on and wrote on Tuesday that he said he got ideas and pages of policy ideas and committees of jurisdiction are working on it, but he refused to give one policy proposal to the GOP conference on our own conference call. Apparently, she said in outrage, I have to go to a SCIF, that's a secure facility, where the public is unable to view to find out the Republican health care plan. She's right, and this deserves to be addressed and answered. I know everyone on this call understands what's going on here. And I want you to know that, and I think you understand that if the Republicans wanted to open the government tomorrow, they could. They control the presidency, the executive branch. They control the House of Representatives, as Marjorie Taylor pointed out, and they control the United States Senate. Speaker Johnson is still refusing to call the House into session, and President Trump will not meet with any Democratic leaders. In fact, he told the Speaker, don't even bother. And of course, the Speaker does everything he says. Democrats have a plan to keep government open, reverse Trump's devastating health care cuts that will kick 15 million Americans off of their coverage. And we have a plan to extend tax credits to help the 20 million people afford their premiums. We're ready to work in good faith to reopen government and get that done, but the Speaker would rather spread lies that we are demanding free health care for undocumented immigrants. That's a flat lie. It's outright false information. And worse yet, the Speaker knows this, and it's been refuted by every single group that understands, from the New York Times to CNN to Access Health Connecticut CEO James Michael to the nonpartisan Kaiser Family Foundation, who has called out them for these irresponsible notions that somehow immigrants are getting these benefits that they are not. Meanwhile, here's the truth. If we don't act on health care, 167,000 Connecticutans will lose coverage and 112,000 will see higher premiums go up next year. The average of family of four will have to pay more than $2,571. Even Marjorie Taylor Greene called that unforgivable. President Trump, as I said earlier, has never had to worry about paying the rent or putting food on the table or paying for his health insurance coverage. He won't lose a moment's sleep over the chaos he is wreaking on the American people. But our job in Congress, both Democrats and Republicans, is to represent the people. To see that federal workers have to suffer during this time is flat out wrong. In empathy with them, I will not be taking my salary as a member of Congress and have introduced Make America Govern Again Act, which for short is to ensure that all federal workers and our troops are paid during the shutdown. The bill would say that the people responsible for the shutdown, aka the policymakers, the members of Congress, the president, his entire cabinet, and all of his agency heads, those are the ones that should have to defer their pay till they come together and pass and lift this government shutdown off of the backs of our people. Our air traffic controllers, Capitol Police, doctors, and nurses, they shouldn't be the ones bearing the burden of this shutdown. Lawmakers who got us into this position are the ones who should feel the pain, and their feet should be held to the fire until they get back to D.C. and do their jobs. We're prepared to go at a moment's notice, and so is Marjorie Taylor Greene, and I commend her for that. I'd also like to, we've heard from many calls, I'd also like to address an issue on this call that many of you have called in and because of your concern about the continued power grab of this president. I think if you heard Senator Chris Murphy on the floor a week and a half ago now, he said the authoritarian takeover isn't coming, it's here. From Washington, D.C. to Chicago, we've seen this president try to deploy our troops against the American people, not on their behalf. A judge has blocked him from sending the National Guard into Chicago, but he's appealing that case to the U.S. Supreme Court. I'm proud again to say that our Attorney General, William Tong, has filed a brief in this case on behalf of the state of Connecticut to challenge this reckless abuse of power. This is not the America we know. We saw this here in Connecticut when men in black masks, armed with weapons, came to a car wash in Newington and Southington and tearing mothers from their children and leaving communities scared go about their daily lives. That's not the America you and I know, love, and respect. These raids are not about safety. They're about fear. We're pushing back every way we know how with legislation that challenges them and with our voices. And we won't be backing down. I don't care how many lists he puts me on. In Congress, I'm championing the No Secret Police Act to require these agents to identify themselves and stop wearing masks. The Trump administration even tried to intimidate many of us, including Leader Jeffries. And, he stood with me, and I was grateful for him for doing that in terms of saying we wear that as a badge of honor. We will not back off of what this president is attempting to do. I, again, want to thank Dr. Cardon for joining us this evening, and I know a great deal of the questions that people have do stem around healthcare. And so with that, I'd like to turn the floor over to Dr. Jim Cardon.
Thank you, Congressman, and I very much appreciate the opportunity to join you this evening and hopefully give some perspective on the impact of these cuts that are coming through the budget and the impact of the exchange. I would like to start to just take a moment, though, to recognize the remarkable progress the state of Connecticut has made over the past 8 years on the quality and safety of healthcare that we in the state have access to. Just recently, the state has been recognized for being the second most accessible state to healthcare. We're third overall in healthcare on the basis of U.S. News and World Report, and we're the fourth safest state for hospital care by Leapfrog. Just to give some perspective, in 2017, we were in the bottom 10% of all states in the country on these kind of measures. So this progress is just really a reflection of the work of all the health system, hospitals, clinicians. But importantly, it's also due to the efforts that our state has made in reducing the number of folks who don't have insurance, both by extending Medicaid when that was available to us, as well as the great programs around the Subsidies on Coverage Connecticut to enhance the exchange subsidies. The budget cuts that have been approved have important consequences. In essence, it's creating more people who have inadequate or no insurance at all, either because they no longer qualify or they cannot afford to purchase health care. I do want to stress that first and foremost, we provide care to everyone regardless of the ability to pay. That's our duty, that's our responsibility, that's why we're here. They get the same quality and they get the same access. However, we do know that folks without insurance will delay care until absolutely necessary. This results in sicker patients, more complicated and expensive care, and potentially worse outcomes, with a reduction in the overall health of all the residents of Connecticut. The lack of a payer source results in an increase in uncompensated care that providers need to provide, which stresses both the financial stability of the entirety of the healthcare system and passes along those costs to others who have to bear the burden. These are just the challenges that we're going to have to mitigate in order to maintain the quality and the performance that we've been able to achieve over these past several years. Happy to answer any questions and provide more detail if that would be helpful. Otherwise, John, I'll turn it back over to you, Congressman.
Well, first and foremost, let me thank you, Jim, and let me also thank Jeff Flax and Hartford Healthcare, the incredible job that you have done. And thank you for citing what the state of Connecticut has been able to do. That's quite a remarkable turnaround from the bottom 10. And it doesn't happen without leadership, the kind of leadership that Hartford Healthcare has provided, and the kind of leadership that Governor Lamont, as well as the Connecticut General Assembly, and also Attorney General Tong have been very successful at as well. And I know both Joe Courtney and myself were delighted and thrilled working very closely with both Manchester and Vernon hospitals to see that they are now part of the Hartford healthcare system. And again, that will be an enormous improvement and much needed for east of the river families, as we refer to them as. And I can't thank Hartford Hospital and the governor enough for the actions that they have taken. And that's all the more reason why these cuts make so little sense at all, and why we're committed to standing by the American citizens and the people who will be impacted. And Jim, I think you made a very good point. It's not only the 15 million that will lose their coverage and the others that will see their premiums rise, but as Jim pointed out, because of a provision called uncompensated care, hospitals are still required to see, and they do, all the individuals that need health care attention, except they do so in the emergency room because people will give up their insurance because they can't afford it. And that will only raise costs for everyone and make the system entirely inefficient and stress it to the maximum. This is why we're fighting so hard. I commend the United States Senate and Dick Blumenthal and Chris Murphy for holding the line and making sure that these get addressed. And we're joined with, ironically, Marjorie Taylor Greene in insisting that Speaker Johnson convene the House of Representatives and take up all the work, including these healthcare related issues, as well as reopening government so that we can proceed. So with that, let us throw it open to the questions that they have. I think, Charles, you reviewed that some of them have been sent in already and others will be taken live.
Exactly. Thank you, Congressman, and thank you, Dr. Cardon. I just want to remind everyone on the line, we have a little over 3,600 folks on the line right now. If you have a question for the Congressman, you can press *3 to get into the queue to be taken live. Now we will begin taking questions from the audience. And we will begin with our first question that was submitted online from Claudia, who joins us tonight from Manchester. And her question is, if President Trump goes through with closing the Office of Special Education, how will that impact children with special needs?
Well, thank you, Claudia, for your question. Since March, the Trump administration has attempted to fire and shut down the Department of Education. Most recently, he laid off nearly the entire staff that oversees special education, commonly referred to, as I'm sure you know, as IDEA, Individuals with Disabilities Education Act, and which promises all students the right to a public education, and these cuts betray that sacred commitment. 76,000 students in Connecticut rely on special education programs that federal funding supports. We need to support the Department of Education and fully fund special education, not defund it. By law, the federal government is supposed to provide 40% of these funds, but it is only in actuality providing roughly 13% and forcing states and towns to make up the difference. For nearly 20 years, I've championed legislation to fully fund, along with all the members of the Connecticut delegation, programs for students with disability. I also submitted a brief with my Democratic colleagues to challenge Trump's gutting of the Department of Education, and the case is currently in front of our courts, an issue that has gone all the way to the Supreme Court. Connecticut remains committed to funding special education and supporting our schools. I'm proud, again, that Attorney General Tong has been a leader in the case challenging these cuts, and of the governor and the General Assembly.
Thank you, Congressman. And as a reminder again, if you have a question tonight, you can press *3 to be placed into the queue. Our next question is an online question from Kyler, who joins us from Hartford, and he asks, how will this shutdown affect veterans' benefits?
Well, thank you, Tyler, for your question. And let me first say that our veterans and military families should never be considered as bargaining chips. It's disgraceful what the president has done here. I mean, these are men and women that put their lives on the line for all of us and for their nation. They deserve the best possible care we can provide and should be honored with not just words, but with actions. It is the least we can do for their sacrifice to our great nation. While the government is shut down, VA medical centers and outpatient clinics are open and providing services as usual, including the VA clinic right here in Newington. Your VA benefit claims will continue to be processed and delivered. This includes disability compensation, pensions, education, and housing benefits. Suicide prevention programs and homelessness services will also continue for veterans. However, the Trump VA Secretary, Doug Collins, has ordered workers to stop communicating with the casework teams in congressional offices. This is outright wrong. It's almost imbecilic for them to try to go across this. These are people that call our offices that need help. This is not acceptable. We will continue, and we are fighting that directive and continue to send inquiries to the VA on your behalf and always will do so. But thank you for that question.
Thank you, Congressman. Our next question comes from Kate, who is joining us from Manchester, and she shares that she was waiting until she was 67 to take Social Security benefits, but wants to know if she should apply early in case the retirement age is raised, or if benefits go away altogether under the Trump administration.
Well, again, thank you for your question, Kate. While I'm not in a position to give you personal financial advice, I can generally state, as I think anyone would, that if you're in a position where you can wait for benefits, it's always a wise idea to wait till they mature. But that's not the case for all people, and some people can't wait till they're 67. As you're probably aware, Congress back in 1982 raised the age from 65 to 67. And I can tell you this, the Democrats in Congress are fighting tooth and nail against plans by Republicans in the Trump administration to raise the age to 70. Here's what people don't understand. For every year you raise the age, people say, well, people are living longer, so therefore they should be able to work longer. Well, not everybody has the same kind of occupation and job, number one, but number two, nor do they have the same health and well-being. So, but what they don't tell you, though, is that for every year you raise the age, that's actuarially a 7% cut in benefits. So to raise the age to 70 with the notion that people are living longer would mean that would be a 21% cut in benefits. So let me get this straight. If you're living longer, you should be living on less. That makes no sense whatsoever. Also, where does the money go that people get from Social Security? Here we are living in this inflationary time, a time when we should be enhancing Social Security, especially for people on fixed income. There are more than 73 million people currently receiving Social Security benefits. Those benefits haven't been enhanced in more than 50 years. Think about this. On average, in all 435 congressional districts, more than $280 million monthly comes into those districts to those Social Security recipients. Where do they spend that money? They're not going out and buying Porsches and Ferraris or widescreen TVs. They're spending it at the grocery store, at the pharmacy. They're paying their heating bills and cooling bills and paying their rent and mortgages and putting gas in their tank. The money all goes right back into our local economy. And especially for people who are on fixed income, who are hurt the most during an inflationary time, this is mandatory, and all it will do is not only help them live out their lives in dignity, but it helps the economy overall. And we need, as Democrats, Republicans, and independents, to be talking about this directly. This is the genius of Roosevelt and what he intended for in a capitalistic, open market, free enterprise system like we have. This is the best way to both provide people with dignity and keep the economy moving. The very small businesses that we want to see grow and we want to see make sure during these times survive are aided by the fact that in 435 districts, people will be receiving benefits and buying the basic necessities that they need to sustain themselves. Thank you for that question. As you can probably tell, I care deeply about Social Security. And to think that Elon Musk and company and these 24-year-olds at Doge have tampered with your personal records, well, that's a whole other conversation, but I'm sure someone might ask about that as well.
As a reminder to everyone who's joined us on the line, if you have a question for the Congressman, please press *3 to be placed into the queue. Our next question comes from Pamela, who's a live caller who's joined us and has a question about Congresswoman Adelita Grijalva. Pamela, you are now live with the Congressman.
Well, thank you very much for taking my call. I appreciate it. I was wondering, based on what Mike Johnson is doing with the representative from Arizona, if, assuming there's a blue wave with the next election, if Mike Johnson could actually refuse to swear people in, well, Democrats in, thereby holding on to the power in the House, even though they technically have lost it.
Well, again, Pamela, it's amazing that we're even talking about these kinds of issues. Imagine that our representative hasn't been sworn in yet. I've had the great privilege to meet and sit and talk with Adelita, and she is the daughter of former Representative Grijalva from Arizona, and won an incredible election, and she deserves to be seated. And the basic truth is that Congress doesn't have to be in session for her to be sworn in and seated, and that's clearly happened in our past. But Speaker Johnson is relying on a loophole that we will, we have to be in session in the House, and even said, and we want, and tried to say that we want the opportunity for her family to be there. Well, her family was there, and have been there, and I think it's an abomination that you would not, and especially, I hope the people of Arizona are as outraged as most Americans are, that Johnson would refuse to swear her in, and to do so by claiming the House has to be in session, which he could call, which Marjorie Taylor Greene is demanding he call to do the work that Congress is supposed to be doing. We have only been in Congress for 19 days since July 5th. That's an important date because that's after they had passed the big, beautiful bill. And so they have not, their so-called version of the big, beautiful bill. But 19 days, it's a dereliction of duty. We are supposed to be in Congress now, and even as Marjorie Taylor Greene says, even if it's to take up Trump's legislation that he's put out there. But I think everybody understands that aside from the Epstein files and other issues, because she would become the 218th person who will sign a petition. It's commonly referred to as a discharge petition, which means the Epstein bill would automatically come before the House of Representatives. And that's what many believe that Johnson has been putting off. Irrespective of that, no individual should be denied the opportunity to be sworn in and represent their state. And, what Johnson is keeping the House on an extended vacation at a time when it needs leadership. He's doing this, though, and I think all of you know this, because that's what Trump has asked him to do. He doesn't want them back here. He doesn't want people speaking out and questioning him, even someone as loyal as Marjorie Taylor Greene, because there's great division even within the Republican conference. And so they don't want them back here, and so they're persisting with this government shutdown plan. It's not going to work, and primarily because people are going to continue to speak out and take to the streets as they did last Saturday when we saw all across the country millions of people turn out. That's what's going to continue to need to happen. But thank you, Pamela, for your question.
As a reminder to everyone on the line, if you have a question for the congressman, you can press *3 now to be placed into the queue. Our next question is an online question from Lorraine, who joins us from Bloomfield. And she says that there are a ton of folks with children that she knows who will have to suffer the consequences if the Trump administration decides to cut off SNAP benefits starting on Saturday. How can they do this?
Well, thank you, Lorraine. The bottom line is they shouldn't. It's immoral, it's wrong, it's unjust, and we're fighting it every step of the way. Again, let me acknowledge both the governor and William Tong and the steps that they are taking. But you're correct, in the 1st District alone, more than 40,000 households receive SNAP benefits, including children, seniors, veterans, and the disabled. The Trump administration put out a statement the other day that said that, well, the well has run dry. Well, and at this time, no November 1st benefits will be issued. That is flat out a lie. It's not true. Congress has authorized $5 billion in contingency funding to keep food assistance flowing into November during the shutdown, which the president already signed into law and is required to follow. Instead, we have a president that's bragging about building a ballroom, his self-declared main priority, while kids are going without food. And if he's not building his own ballroom, he's sending money to Argentina instead of feeding his fellow Americans. We will continue to demand these funds be released to feed the 42 million nationwide SNAP recipients. I am grateful again for Attorney Tong and also for Governor Lamont and the General Assembly and the work that they're doing. And let us hope that we get through this. But, kids' lives, the disabled, veterans, and seniors, they should not be pawns with Trump's political ambition and goals. These are basic, essential needs that people need simply to survive and sustain themselves. Thank you, Lorraine, for your question.
Our next question comes from Winston, who joins us from Bloomfield tonight, and he has a question about some recent comments made by the president about running for a 3rd term. Winston, you are now live with the congressman.
Congressman Larson, thank you for taking the call. And as indicated, my question centers around the authoritarian takeover of this government, of this president of our government, and focuses on many things. And there's online chatter that not uncommonly things that he chose about can become policy or action. So what's going to stop him from trying to circumvent the 22nd Amendment? He's already attacking the 14th Amendment, and he's doing things like destroying important historical structures such as the East Wing of the White House. So what's going to stop him from continuing to be destructive and chaotic in his actions and trying to seek a 3rd term by possibly finding a way to call martial law and saying that there'll be no elections?
Well, the 22nd Amendment is very clear, Winston, and presidents can have 2 terms. He will not have a 3rd term. I know it's frustrating and disturbing out there, especially when you hear his minions like Steve Bannon try to make this argument and stir the pot, and Trump himself, he loves this. It just totally feeds his ego. I think it's the columnist David Brooks who said that, Donald Trump is what he called a narcissistic nihilist, meaning he's totally consumed with his own ego and himself and his grasp of power. And that's what this is all about. But you take an oath of office, you take an oath to the Constitution of the United States that starts with "we the people." And it is we the people. Just as it happened, and one of my favorite stories is to talk about George Washington, who credited of all people, Thomas Paine, with being the person that really was responsible for the American Revolution. And there's an interesting similarity here. Here's what he said. Washington in 1775, so 250 years ago. The tattered then Continental Army was just outside of Boston, and the then Continental Congress was meeting. And that Continental Congress was loaded at the time with people known as Tories. You'll recall from your history that Tories were people that were sympathetic to the king, sympathetic to the crown. And the strong movement at the time, and Washington feared this, was that they wanted to reconcile, that the British blockade had impacted economically the ports of everything from Boston to New York to Philadelphia, all along the eastern seaboard. And it was having an economic impact. And there was grave concern that people were going to turn and reconcile with the king and want to go back to the way things were. Until Thomas Paine produced a 46-page pamphlet called Common Sense. It was the most well-read document in the 13 colonies other than the Bible. And Washington credited the people of the country with calling upon and prevailing upon their representatives that they sent to the Continental Congress to vote for independence and liberty. And they did. They passed the Declaration of Independence. Not because of Jefferson, Adams, Franklin, but because the people who read and felt and believed what was the right thing as noted by Thomas Paine in his book Common Sense. And so Washington invited Paine to the White House as one of his first guests, and he told him, he said, "You're directly responsible for this revolution and for the creation of this new government." He says, "No, I'm not responsible for it. The people are responsible for it. It was the people that called their representatives and prevailed upon them to do the right thing. That's why your voice, that's why these town hall meetings, these phone calls, everything that's going on in the country, the No Kings movement, everything where people are voicing their opinion and letting it be known is what will shape Congress and representatives and the outcome in the future." So Donald Trump, as much as he would like to leverage this and talk about it, he can talk about it all he wants, but the 22nd Amendment and the Constitution are very clear. Presidents have 2 terms, and all the Connecticut delegation, all the New England delegation, and others will all stand and fight this tooth and nail. And I even believe as the Supreme Court would have to follow this constitutionally.
Thank you, Congressman. Our next question comes from Michelle, who's joining us from West Hartford, and she has a question on how the House has been out of session. Michelle, you are now live with the Congressman.
Hi, Congressman. Thank you for holding this town hall. We really appreciate the chance to have our questions heard.
Thanks,
You're welcome. I'm a bit frustrated, and forgive me if this comes off as a little crazy, but I'm just wondering, if the Republicans are following no rules, like, why are we holding ourselves to the standard where we have to follow every rule? And why don't we just have Hakeem Jeffries call a House into session, and when they say, "Oh no, only Mike Johnson can do that," we say, "Well, no, that's not true. That's not in the Constitution. We're voting. Come to vote or don't go to work. That's up to you, but we're voting and we're going back to work." And say, if you got a problem with it, take it up with the judge, because that's what they're doing to the Democrats on so many fronts. And I would just love to see us go back to work, and I think they would scramble and I think they would panic, and I think that they would show up.
Well, part of what you're saying is already taking place. And that's why we were down in Washington this week and why I just got home tonight, because Hakeem Jeffries called us down there to go about our work and continue this. But we are a nation of laws, and we are governed by laws and rules. And he is the Speaker of the House, duly elected, and they are the majority, duly elected by the American people, and that Constitution we refer to as we the people. And so I appreciate your frustration, though, because we hear this all the time from individuals. And Hakeem Jeffries I'm going to have him up to the state of Connecticut in the next several months, just so people get to hear him speak and get an opportunity to meet him. I don't know if you happen to witness that he stood on 8 hours and addressed the entire Republican budget without a note and went over by line. He is, but Hakeem Jeffries and the Democrats, we are going to continue to fight in every manner that we can, and we'll do so within the law and accordingly. And when you start seeing the Marjorie Taylor Greens and other Republicans, there's a reason why Johnson's calling them back, because they're as fed up as well. And as this continues to impact them, in fact, the truth be known that more red states are going to be and hurt by these cuts to health care that are going to happen, and the lack of a benefit that's tax from the Affordable Care Act is hurting numerous families, and that is what's going to cause the outrage. But I know, and especially in this day and age, it's not like back in the days of Thomas Paine, when there was no radio, there was no TV, there was no mass communication, there was no internet. Today, people get information instantly, all kinds of information. Some true, obviously very false, but there's a desire to see something happen instantly. And a democracy doesn't move instantly. And there's pluses and minuses to that. I appreciate but assure you that the effort is being made on a daily basis to get them back and to do the right thing. But thank you for your question. And not only get frustrated, but vote. And people say, well, vote, but the election is more. It's talking about what's happening, talking needs to change, talking about the disgust of what this president is doing that's going to lead to the change. He's convinced that he's going to be able to turn people away, that he's low as his ratings are, they're still higher than ratings of, the media and the United States Congress. He's convinced that he can continue to divide America and frustrate them. More people didn't last presidential election than who voted for both presidential candidates combined. That should alarm every American, so that you make sure that in getting your friends and family members here in the state and outside of the state and around the nation to understand the importance of your vote and your Constitution, not any authoritarian figure in either party.
Our next question is an online question from James, who's in Berlin, and he has a question for the Congressman and Dr. Cardon, asking what will the impact be of Trump's health care cuts to Medicaid, Medicare, and the Affordable Care Act especially for people who are not on those programs?
I'm gonna let Jim handle that question, and I'll chime in. But Jim, go ahead.
Thanks, Congressman. So if I can reframe the question. So the cuts that are occurring in the government programs, both Medicare and Medicaid, and the subsidies, obviously have impact on the people who are in those programs now, in that either they are potentially going to lose the benefits of that insurance because they're unqualified, or they can no longer afford it because the subsidies are cut. What the Congressman related to, and I commented on, is that those cuts mean that when you're providing care, the sources of funds that help pay for all the people who are delivering the care and the stuff and the buildings and everything you need comes from those three payer sources. Government is Medicare and Medicaid, and the last is commercial insurance, of which exchange is one. But all the employers and folks who sign up for insurance individually all have to pool that money that covers the cost of delivering care. When the two revenue sources really drop off because you have people who can't afford to pay for care, the rest of everybody who can, and the insurers and everybody else, have to help cover the cost of delivering that care. So in essence, when you cut these, it's not that it goes away, it gets shifted. And that burden is sort of borne by a smaller and smaller group of people who have to pay more. So it ultimately drives up the cost for everybody and puts the systems and providers at risk because they may not have the revenue they need to cover all the cost to deliver the care they're giving. The entire thing is sort of a cascade of dependencies across all of these things that once you pull the rug out from one, to some degree, everything starts to tumble. I hope that answers the question. Congressman, if you have anything to add, that'd be great.
Well, I love the term a cascade of dependency, and because that's what we see happening, and then the economic impacts of that cascade as well. And as Dr. Cardon has pointed out, the impact that has on our overall healthcare system. I'd also like to, you hear a lot of stories when you're out and about and talking and holding discussions like this. And I heard a very telling story about Jeff Flax in Hartford Hospital that, and this was more than a year and a half ago, when someone said, he ordered us to go out at night after he saw people sleeping under bridges and gather them in and pick them up and bring them to the hospital to give them shelter and to feed them. And did that without any notice or any publicity or anything, but did it because that's what he believed in. That was the right thing to do. And something that's missing with this president is an understanding of the humanity that's involved here. And perhaps it's the way that he was brought up, but I can't imagine any human being knowing what these programs, both SNAP and healthcare benefits, provide for Americans, for our citizens, for our children, for veterans, for the disabled, for the elderly, could sit back in the greatest and wealthiest country in the world and allow this to happen? That's not the America we know. That's not the America we love. And that's not what Americans believe. We do the right thing when we're faced with it. And this is a time we're faced with doing the right thing. Thank all of you. Thank you, Dr. Cardon, for joining us this evening, and thank everyone for being on this call. We'll be doing more of these as we go forward. I also like to go out and do town halls, but we're able to reach far many more people. I guess as Charles was saying at the beginning, we have more than 3,000 people on the call, and that's important because we want to keep people informed and aware and involved and committed and spreading the word about doing the right thing. Thank you. God bless you. God bless America.
Thank you, Congressman. We are coming to the end of our live event this evening. Thank you for taking the time to join us for this Access Live telephone town hall with Congressman John Larson. If we were not able to get to your question, you can leave a voicemail after the event by calling 860-278-8888. Thank you and good night.